Hey guys, how we doing? Today we're going to be talking about holistic dentistry, holistic treatment and dentistry. A little bit of a a little bit of a left field topic today. We've got someone who actually does holistic treatments within dental practice. Hi Becca, how you doing? So we just want to find out how that kind of works. So let's see if she is in the house already. How's everyone doing? Farouk, hey, how's it going? We've got a request already. Awesome, it should be working. Let's see.
Assalamu alaikum.
How's it going?
Alhamdulillah, I'm fine. Sorry for about the delay. It's been a lovely day today, alhamdulillah.
Yeah. We've had not a bad run of it recently.
Yes, alhamdulillah. Obviously, we're in lockdown, so alhamdulillah. It's better than rain anyway.
Yeah, 100%. So, can you turn that volume down a little bit? It's getting a bit of feedback.
All right.
See
Sorry,
if that's better enough.
I'm not good with these things, right? Yeah.
Sometimes it's not too bad. I think that's okay, guys. Guys who are watching, just let me know how that sounds. Hopefully that should be okay. But can you tell us a little bit about, because you work in a dental practice, but you're not a dentist, right?
Yes, I know. I'm in a very unusual position. My name is Shanila. I'm a holistic therapist, so I do cupping, acupuncture, hijama as well. And the unique thing about me is that I actually work in a private medical and dental practice in Bolton. So alhamdulillah, I'm becoming quite knowledgeable on the dentist front. My daughter's 16 and she actually wants to become a dentist, so now I'm learning a lot more about the education and all the things that everybody needs to go through to become a dentist.
Yeah.
And so so then I see some patients that come to me because one of the dentists, she's actually an expert in hypnotherapy and anxious patients. But now we've started combining treatments in the fact that I've started doing acupuncture treatments for the clients while they're in the actual dental practice, and so they have the acupuncture first to calm them down and to get them less anxious, and then they go through and do all the dental treatments and everything like that. And there is also we have acupuncture points for things like toothache and pain and things like that as well.
How did you end up in a kind of a medical and dental clinic? Because that's kind of it's not a usual setup from the sounds of things.
No, what it was is I went on a course and the practice manager was on the same course. I was up in London and I was just about to do my Hajj, and one of my great lovely friends were like, right, you need to stop doing home treatments and you need to find a practice. I said, well, after Hajj I'll start looking, because I'm not going to do it after Hajj. And it was Ramadan, and then I went on this course, and as I was walking out, the practice manager came up to me. Well, the actual director of the company came up to me and said that he would like me to come on board, and if I would be interested. So when I looked, because I've never noticed. Obviously, you look at all the holistic settings, but as dentals, you've got the highest level of cleanliness. The highest levels of protocols of cleaning and all of this. Even like with the COVID stuff, it's like, well, we've already got the equipment and everything is in place. It's very easy for us because we're quite used to doing all of them very rigorous hygiene,
Cross infection control, yeah.
Because that's what we need to do as a practice. Even though you've got treatment rooms, you've got 3 treatment rooms, and then we've got about 3 dental rooms in the surgery. But again, the whole practice has to adhere to the dental regime.
Yeah, that makes sense. How have the dentists kind of reacted or been able to incorporate this kind of treatment that you're doing? Do they use it a lot, or is it just for certain patients? How does it work?
It's just for certain patients, because obviously with dentistry and with medical, what it is that if you recommend something and it doesn't work, then the patient has the chance to sue you, really, isn't it? So then that's why you really don't recommend holistic treatments. But then, alhamdulillah, the way that we get around that is that the secretaries will then you know, recommend something or whatever. So then it's not a direct referral from a dentist, but it's strongly advised.
Yeah, I think things like this, that it will work for some people, it might not work for some others
Yeah.
anyway. So that's kind of not. I wouldn't say that's a major issue. Um, what kind of signs are there that somebody might benefit? What kind of people are generally benefiting from your experience? Like anything that you can point out, going, actually, if you see X, Y, and Z, this
Yeah.
person might be a good candidate.
Again, it's people that are feeling a lot, are anxious. Again, they are very scared of the actual dental procedure. They're scared of all the noises and all the, because you need you know, like that's why you have to have good dexterity, because there's a lot of instruments that actually need to go
Mhm.
into the mouth to do a treatment, and I think that is very, very invasive when you're lying down and you're not, and especially when you're hyperventilating. So it's like small things like making sure that they like talking to them with breathing technique to try and control their own anxieties, and breathing will make the whole experience a lot easier. But
Yeah.
on the flip side, I also have the thing of that I have a lot of dentist clients that come to me because you guys have got lovely, lovely hunched backs and a lot of you know,
Tension building up. Yeah.
tension here on the traps, and you sometimes get quite a lot of migraines as well. So then I also treat all the dentists, and then I also advise that, you know, like make your seat a little bit higher or lower, and have a look and try and really get your posture right, because I know that you're doing a brilliant job at curing all our mouth issues, but you're not doing your shoulders any good.
Yeah.
Like you do that, because that's what it is I have a lot of dental clients, and the medical profession, I have some doctors and dentists, and they enjoy coming to my clinic, because obviously when you're used to having rigorous regimes of cleanliness and protocol, you feel quite safe and secure being in a
Mm.
setting that you recognize as having the same standards as the standards that you want for yourself as well.
So what things are you seeing commonly with dentists who are coming in, and how are we correcting those?
A lot of dentists with lots and lots of shoulder pain and bad posture, but it's very much particularly in the trap region. So very tight traps, and then also all the way down here as well. And so I get quite a few of them. I have a lovely client of mine who's a dentist. She works at one of the hospitals in a private hospital, and she often sends me messages, things like, my body, I don't remember you, but my body remembers you. So it's
Mm.
also important as a dentist to look after yourself and have regular holistic treatments, to really, like, exercise is really, really important, stretching, physio, but sometimes also a little bit of cupping, and something that goes a little bit more deeper to really relax their muscles, really work really well, and they work hand in hand with all the other good stuff that you do for yourself as well.
What kind of things does copying alleviate, for example?
Cupping alleviates quite a lot, and I remember one of the also because I have the twofold where I have dentists as clients, and I have
Patients as well.
patients with the dental issues as well. So then things like TMJ, TNJ, I've helped a lot using acupuncture and the cupping for the facial cupping and acupuncture after, and so that really helps relax issues. So then that's something that's like a dental issue that can be helped very easily holistically as well. And then also, again, I was listening to some of your lives where the fact that you were saying about vitamin D deficiency and
Yeah.
and I'm a big advocate of vitamin D supplements and vitamin C actually as well.
Yeah.
Like my mother herself, she had lots of bleeding gums and everything. She started on vitamin C, and then her dentist was quite like, oh, like what's happened? The bleeding had finished. And I myself, I realized that in the whole of Ramadan, I haven't had my supplements very how I
Regularly.
normally have them,
Mm.
and now my gums have started bleeding a little bit. So it's like, oh, okay. So so you just see all of them kind of correlations between the dental world and the holistic world, and I feel a bit like because the mouth is the entrance to the gut, and I almost feel as though dentists, they're trained just to look at the mouth, but really there's so many things that they can look at with people that are more holistic, and you can look at the whole
Yeah.
person as well.
Heba is asking, are there any risks with cupping?
Well, the risks with cupping again, if you find, because I have a rigorous assessment of the history, and I have a look at what the client has had previously and some of the issues and medical history, which is always important to have, as you will know with your profession as well. If you don't have the medical history, you can do quite a lot of damage. But if you have the medical history, then there's quite a lot of risks that can be alleviated. And also what we have to do is look at what type of cupping as well, because alhamdulillah, I do massage cupping, I do fire cupping, and then I do the hijama cupping, which is actually the blood as well. And a lot of therapists, they don't actually prepare the body for the extraction of blood. So when you do a massage and you warm up all the blood vessels and you warm up all that stagnant blood, then you're gonna get a really better treatment.
That's my brother. He's asking why Olympic athletes do cupping.
Because it's absolutely excellent to help you get your body ready in terms of exercise and that, and it gets rid of all the stagnant blood. So when you have muscles and you're training, you can sometimes have stagnant blood, and what that cupping will actually do is alleviate that stagnation. But then when I look at the cupping marks, I'm like, I think he should have started about 6 months ago, because they shouldn't be that dark right at the beginning of a session, because even obviously I mainly treat women, so then it's a little bit hard to have pictures of all the cupping marks.
Yeah.
I do know, like from my own husband, because he gets cupping very regular from me. When I first started, his marks were like proper, like
dark,
purpley reddy, and now when you look at it, they're always like, just like, it just depends on what he's doing, but then they're very pinky reddy now, so they're not as prominent. But then if you have cupping, and also there have been studies shown that when you have the cupping after 24 hours, you can do your personal best in terms of running or achieving your fitness goals as well.
Yeah. What is the difference between the three types that you mentioned? What's the difference between those?
The three types mentioned. If when you have fire cupping, so basically that's a glass cup, and with normal cupping, what you will have is a plastic cup with a little pump, and so that will pump up. And with the fire cupping, it's a glass, and you actually use a live flame to use it as a pump. But that is a lot more comfortable, and it's a lot more easier to do actually the massage aspect of it with the glass. And the plastic pumps are really good for stagnant, and then you use the plastic cups, but then you do little incisions, and also obviously the blade use only, and then them plastic cups, once they've used, then they have to be disposed of properly.
Yeah.
So they're single use, but whereas the glass ones then go into the room and gets disinfected as well.
Yeah, I think everyone's going to need it apparently after big PPE sessions and stuff. That's true. In terms of pressure points, are the things that people we can, we're going to have a lot of people who aren't being able to come into surgery at the moment with everything that's going on. Is there things that we can recommend people do at home which might help with things like TMD?
Yes, there are. There is definitely, and I will give you, if you want, I can give you my favorite three, 4 point. Well, actually, technically, it's 4 points. Treatment protocol. So what you
Yep.
basically do is, in order to, activate a pressure point, what I've always found easier is just imagine this is my skin, and if you use your 3 fingers here, like, well, I know it's 4, but like 4 little fingers, just get rid of your pinky, and if you were to just press it and then clockwise circular motion, that will activate a pressure point. So here, okay, I'll just move the camera so you can see. So basically you have a point that's right in between the breastbone here, so you go straight in and you clockwise rotate. Now this is really, it's right near the heart. It's really good for any anxiety, and it's good to open up the chest, and it also opens up the lung area as well. Then what you have is, if you have your pecs here, and if you just come up, and there's a little depression here on the shoulder.
There.
Yeah, right there. And can you feel that depression? And if you were to press that, it is quite prominent. So if you go up, slightly up, so you need to get into the depression. So off the bulging bone, off the bulging muscle, and right there.
Yeah.
So if you were to do that both sides, they're really good. And then you have this one here, which is there, which will
it's quite well known there.
Yeah, with the Taiyang point, which is really, really good for any kind of anxiety. And also, what the good thing is with all of this is also it's opening up the lung region. So obviously with coughing and things like that, well, it's really, really good. And so that's one of my, because I have a lot of ladies, because I also have my other niche market, which is fertility. So I have a lot of ladies that are going through fertility treatments. And I like these 4 little points that I show them, so that they, instead of being anxious, they can press these points and do the breathing exercises that I teach them to reduce that anxiety.
Any specific pressure points for diabetic patients?
Any specific points with again with the diabetes, you've got type 1 and type 2 diabetic points as well. So then basically you have something called the 4 gates. So then you would press them as well. And again with toothache and any kind of pain, sorry, I'm not really good with this camera, it's just right in between the thumb and this, in between the carpal, in between the muscles, and it's right there. And when you press that, that actually alleviates a lot of pain. And so then that's one of my classic points that I use for toothache. So if anyone has got toothache, and I have my little niece, she was teething and she was very, very uncomfortable. So I just very gently pressed them points and massaged them, and within half an hour she stopped crying and she fell asleep. So it was really good. But even with diabetics, again, you need to understand your points, and even look at your trigger points and look up acupuncture points as well.
Yeah,
because there are quite a few, but the most effective diabetic points are on your back.
Okay, so quite difficult to get to by yourself.
Yeah. So they're quite difficult to get to by the backs.
And for TMJ, where was the point for that?
Right. Well, the TMJ, what it is it's very, very hard to do just with your fingers, but because basically where your ears are, you have 3 points here, 1, 2, 3, and it's right in the middle. So if you were to go and open the jaw, then you have an expression. And then what I do is I make them do stick the needle in, and then they can actually talk to me again, and that goes straight into the TMJ.
Right. Okay. So that's not something you can really do at home, is it?
No. I don't. I think that would be a bit hard.
Yeah.
To do that.
It's
because my child had a TMJ problem. What happened was is that she had excruciating pain. So I took her to the dentist, and the dentist went, "Oh no, no." I took her to the doctor, and the doctor went, "No, no, this is a toothache, so you need to go to the dentist." So I went to the dentist, and the dentist went, "Oh, it's TMJ. She's grinding her teeth." So I was like, "Right." So I was like, "Are you Pakistani?" I was like, "Could you get home?" Let me get my cupping. Let me get my cupping stuff. So I gave her a proper facial cupping massaged everything out, and then put the needle there. And then after that, she's never had any kind of pain there at all. So alhamdulillah, that sorted it out. But I spent the whole day in the walk-in centre
to find out what's going on. Yeah.
Yeah.
Guys, any questions for Shanila? I think that's most of what you're kind of doing day-to-day basis, really, isn't it?
Day-to-day basis is basically I do a lot of fertility issues and everything like that. And again, you know, dentistry, and as well as all the other kind of professions. No one is immune to these kind of issues. So then that's basically now becoming my like niche. But then I also deal with things like back pain, sciatica, migraines. And then I'm doing all of these kind of things. So alhamdulillah, it's interesting because I enjoy all the different types of issues that I come across. It's really cool, and I like to get a case where I'm like, oh, let me have a look at them points, and let me have a read. I'm not quite, because all the normal things that you kind of deal with, you know them points off by heart, and you're all right with them. And sometimes you're like, oh, it's been a long time since I've done that.
Yeah, I think dentists get quite a lot of back pain as well, especially in the lower back. So what are the bits and pieces that you do for those guys? We're actually going to be speaking to a chiropractor later in the week. So that maybe is going to tie in a little bit this week. We're going to be doing a couple of kind of non-dental sort of things.
Yeah, no, and thank you very much, because it's really nice, because again, you're looking after dentistry holistically. And so it's really, really nice that you invited me to come and speak. So I'm really honoured for that. So Jazakallah khair, that's really nice.
No problem.
Yes, chiropractic is really important. I'm trained in Twina, which is a Chinese medical massage, and so I'm actually insured to do basic back cracks and things like that. I've not done them for a long time, but I am insured. So what it is again with back pain, what I found is with dentists is you have your chair and you have the wheels, but your feet are not on the ground 100% all day, because of obviously you need to be higher than the patient, and it also depends on whether you're tall or short or whatever. And what that's doing is it's putting more pressure on the lumbar region of your back, because because all your leg weight is pulling on them lumbar muscles. So again, with back pain, I've actually I call it the 3D massage. So basically, I first use my hands to assess everything. I then warm up the muscles with my hands and start doing a deep tissue. Then what I do is I start using a tool to tonify all the organs, and also tonify the whole of the muscle. And then what I do is I do the fire cupping, and then after that I do the fixed cupping as well. So alhamdulillah, it works really, really effectively for any kind of back pain. I've had some phenomenal results with that. But yes, you know, like again, if I could change some of the seatings with dentist, I would like put like a little, I don't know, a little plank of wood where you can actually ground your feet, so it's a lot more easier. But then it's a lot, because you're always moving from here to here to get your tool. So sometimes it's not convenient to have that kind of thing. But it's just having that conscious of like, okay, let me ground my feet, and let me
I'm just thinking I'm going to move my chair forward now, the one I'm sat on now.
No, but that's what it is.
We like going back.
Yes.
But actually, it sounds like we want to be kind of almost tipped this way
Yes,
on
you
that
almost,
slope.
yeah, you might almost want to go to the slope and wherever. It's because like my husband, he does lots of driving and his seat was always back, and then obviously he and now slowly he's got used to being more on an upright position. And again, that's with dentists, it's really easy to be slouched and just to go back, but then you're
Mm-hmm.
basically, what you're doing is then you, some of the muscles that are meant to be lengthened are shortening, the muscles that are meant to be shortened are lengthening, and then you've got your added weight of all your legs and your feet, and then all your, you know, and your feet are not actually grounded to the floor, so they're alleviated. So all of that is basically, you know,
Upside down.
yeah, you're really not helping yourself.
So if we've taken L shape as your body,
Yeah,
you don't want that L shape to be there and then up and
no,
there.
yeah,
You want it to be there, almost either across and down,
yeah,
or like kind of diagonally down and then going. Does that
yeah.
sound about right?
Yeah, that sounds right, and it's just having that kind of conscience, because obviously in dental school you're taught so many things that you're too busy learning your new techniques and developing that dexterity that you need to become a dentist, which is all well and good, but I don't think posture and posture is very much taught in your training.
I think it's touched upon, but it's not policed. Like they say, "Oh, make sure your posture's good and yeah, don't slouch." But when it comes down to it, you're kind of looking in the mouth and they forget as well as. So maybe that's part of it.
Yeah, it's because like that. It's because obviously, and it's all well and good, you know, someone's just saying that posture needs to be focused on
Mm,
in school, but yeah, but a lot of things, you know, someone will not remember it. But I'm telling you, a woman that has come and has had excruciating back pain, then has a treatment, then they are very conscious of what's happening with their body, and then they will go back to work and they will almost instantly recognize what position is my body going in that is giving me that pain, because then that pain will come back. Or then again, like one of my two of my regular dentists that always come to me, she's like, well, I can't help myself, so then she just books in every 3 months to see me, and just have regular 3 monthly treatment,
yeah,
regular three treatment, because again, if you can't do anything, you still need to help yourself with your posture, and you should get some regular massages or regular hot stone, be it hot stone cupping. Obviously I'm going to advocate cupping a lot more than hot stone, because that's what and even sports massage therapists are
mm,
really good, because I think a lot of people associate sports massage with just people that are athletes, but they are very good for back pain as well.
yeah. Well, I think everyone who works within dentistry at some point has some sort of back niggles. I know that I have, and we spoke about that with. I think it was Dr. Ansel we spoke about it with last week. We kind of touched upon the subject, but it once you kind of lay it out and say actually it's the chair and the angle of your legs, it starts to make a lot of sense when you think about how you're sitting. Uh,
And it's also like with the client, because sometimes you almost feel like, okay, you are moving the client bed down, but
mm,
even if you were to move it a slight five degrees even more, or even 10 degrees more, that would make your work a lot more easier.
yeah, yeah, I think that makes sense, and you need them probably a bit lower.
Mm,
Almost it looks a bit funny where they're almost at the level of your knees probably, so you're looking down kind of nice and neutrally, as
yeah.
opposed to a bit too high, so you're stretching forwards.
Mm. Because that's what you're doing, is because, and you're not actually realizing that the equipment that you have got has potentially a lot to help you keep yourself quite relaxed, and
Mm,
what you're doing is you're basically using these shoulders, and you're not meant to be using these shoulders, you're meant to be using your lower back to move.
yeah,
So when I'm doing this, or if I'm doing this, there's a huge difference between the two actions.
yeah,
Yeah,
yeah. I think that makes sense.
but again, it's having that seed and having that conscious of what am I doing with my body? Am I reading my body? Am I actually reading the signs where I'm feeling a little bit uncomfortable? And it will be like, oh, it's fine, I feel all right, you know. But then continuously that action is going to give you long-term back pain.
Yeah, and I think me and I think it was Dr. Ansar last week that we spoke about this. We both said that the times when we've either stopped working out so much and you could feel some of your muscles getting a little bit weaker, then these sorts of niggles come a lot faster and a lot quicker, and also almost as a byproduct of you not being fit. So it kind of, there's a bunch of factors that go into it, as we kind of touched upon there.
Yeah, no, and I was privileged to listen to half of your live with Dr. Ansar, which were really, really interesting, and I totally echo exactly what you're saying, is because you really need to look after yourselves, because it's a very high demanding job. And a majority of all my clients, be it makeup artists, be it you know, people that even are on call center jobs, I'm always talking about the posture. I'm always like, right, okay, if there's carpal tunnel, why is there carpal tunnel? What tools are you using in your job, and what actions are you doing continuously? So I'm very much, I very much look at the person as a whole, and alhamdulillah, that's why I have got the you know, like the clients that come to me, alhamdulillah, you know, they then refer me to other people, because I'm always looking at the individual. I'm always looking at how can I help this person do their job better, and how can I make my life easier? Because if your posture is good, then you don't need to come to me as much. You know, I'm quite a funny client like that, because again, I take inspiration that one of the acupuncture teachers, they were saying that a good therapist is a therapist that somebody only comes to see maximum 5 times. So you know, so that's what I try to have a solution of something within 4 treatments, which you know, and so then at least the client also knows as well.
Yeah, I think that's that kind of almost makes sense. Like, you don't want a gum disease patient coming back again and again, because they can get on top of it. Obviously, it never goes away, but you know, if they're coming every 3 months, that means there's fewer people who can come and see you, because it takes a lot of time.
You know,
somebody, yeah.
No, it's all right. You can carry on.
No, there's another question, but carry on with that. We'll go.
All right. No, I think that I've lost my trail of thought. Like you normally do.
Somebody was asking about remedies for pregnancy. I think if you message Shanila afterwards, that's probably more off topic than we were planning on going today.
Yeah, that's very off topic, but yes, I can help you. Feel free to start following me, and then just send me a DM, because obviously every case with that is very, very individualized, and it's very hard to give general tips, because I'm sure Uncle Google gives a lot of tips generally anyway.
Yeah. What have we got left? So a couple of guys are talking about indirect vision. So yeah, I think that's part of it. That's using the mirrors. If you're not using the mirror, you're going to have to bend your head over. So if guys are getting to grips with indirect vision, that should help a great deal. Any other common things that you're seeing with dental patients that seems to work and help?
It's an interesting one, is because again with the dental, it's more about the anxiety and more about the toothache. And I've been getting so many messages about people that are really, really have a lot of toothache and everything. And even one of my aunties was trying to get a false filling and from the internet, and I was like, no, you can't do that. And so so it's basically because again, with the dental patients, a dental patient can be a holistic patient, can be any kind of patient in that way. So everybody has individual needs, and the reason why they'll dentist and a specialist center is because they you know, they've not seen a dentist in a long while, and they need to sort out the kind of teeth that they want, or you know,
Mm.
kind of pain. But it's basically people that are living with long-term pain, that it's the hard one, and the anxiety, because a lot of people are like, I don't like dentists, I don't like needles. You know, a lot of people are also scared about the actual acupuncture needles that you use. So
Yeah.
it's very, very hard sometimes. You know, and it's all to do with the mind. So you're constantly coaching them and constantly reassuring them. And again, it's about trust. So like, I use social media to build that trust, so that they almost know who they're coming from, and that whether they've come to see a friend or somebody who they've got quite a lot of trust. And that also helps, because then you can start the treatment, not as complete strangers, but there is some familiarity
Yeah.
with well.
Something that I think we were talking about last week, which is when we kind of decided we were going to do this, was I think you and Doc were talking in my live last week about personalities or temperaments.
Yeah, temperaments, humours. So
Mm.
this is now going back to Ibn Sina era and Tib medicine. So this is very old Islamic and Arab medicine. So that this was all the thing, and basically what you have is, you have four humours. So one of the humours is hot, one is cold, one is phlegmic, and one is more biley. So you basically, and there's also like facial features, and so you can see the puffiness in somebody's eyes and in their face, and you can almost tell what kind of problems you're going to see. And again, because I do acupuncture, with acupuncture it's basically the same kind of thing, where you have four, but then you have hot, dry, and wet, and cold. So you know, you have a combination of them four, and it's basically the same principles with different
Mm.
names actually. And even when you look at the old Indian kind of
Medicine.
medicine, Ayurvedic medicine, again, the everything goes into the four humours. So then you have a look at the type of people that you meet and the type of patients that you have. And again, in terms of worried clients, there will be ones that are very, very phlegmy, and they're always worrying and they're always thinking. And then you also have the worriers that have got very fine eye for detail. So then they're always looking at the small picture. And then you have like the party goers, and the ones that are like, oh, it's fine, but them are more people that are looking. They look more at the
Big
big
picture.
picture,
Yeah.
and they're not really bothered about the fine details. And then you have the other types that are in between. So you have these two extremes, and it's really, really interesting, because I almost because I've studied it in quite detail, I almost understand what kind of client I'm going to deal with, just with having a DM conversation with them, and
Yeah.
with the types of things. And then you know, there'll be things that I'll ask them to do and they won't do them, and you're just like, okay, then I know what that kind of person. So you know almost instantly, you know, with the personalities. But it's really, really interesting, and I would love to know what Dr. Ansar, how he's translating all of this information to dentistry. But I myself look at it in all the practice. And again, with people, the people that have got a lot of phlegm, I won't. I'll look at the tongue, and I'll know whether this person is going to bleed, whether the wet hijama is not good for them. I should do the fire cupping as opposed to, so to try and get that. So I use all that knowledge and I translate it into having an individualized system, because hijama is beautiful. It's the sunnah of Muhammad Sallallahu Alaihi Wasallam, but sometimes it's not appropriate for the person that I'm dealing with. So at least I've got other things that
Yeah.
I can actually give to them.
Is that something that you think everyone can? Because we were talking more about with Dr. Ansar, how we kind of end up self-selecting patients who are kind of the same as us. I think that's where it came in.
Yeah, yeah,
Um, but obviously, if we're working NHS or something like that, it's just useful to know these kinds of things, because then you can say, okay, this person's going to be more difficult to convince to brush twice a day. or whatever whatever we're trying to ask them to do to keep
It's
healthy.
because what it is I saw it because if you look in terms of marketing, there's some people that you can basically then you in order to get one message across, you need to use four types of messages. One can be an emotional message, like or the one can be more of a threatening message,
Technical, right?
a technical message, like saying, a picture of, like, the famous picture of the man with no teeth and he's not got one eyebrow.
Mm,
So then that's more like, I don't want to end up like this guy. And then there'll be your more of the people that are eye to detail, so they will want to know more of the studies and the more of the scientific. Why scientifically do I need to brush my teeth? And what happens is you get used to talking to one type of client. You get used to talking to one type of people, and because you'll attract people that are more that are like you. You'll attract your own tribe, so and people are like-mindedly attracted to you. But then if you're in the driving seat, then you can also move your marketing and move your message. So I do have, like, even though I'm doing my treatments, I do have like four various ways of talking to them. And I think it's a bit boring if you're attracting the same type of people. But sometimes,
mm.
the people that for eye to detail something, sometimes you just like, and then I'll almost have people that are saying, "Oh, I'm sorry, I'm doing your head in," but because I understand that that's that personality, I'm not going to get annoyed by that person.
Yeah, I think it's one of those things that, yeah, someone like myself or Doc, we probably start to think, actually we've got we'd much rather have the easiness of knowing exactly what's coming in, and they're going to be happy with it, and we don't have to stress too much about convincing them that actually, yeah, they do need to brush the teeth or whatever it is we're trying to say to them.
Yeah.
So it kind of works both ways, I suppose. Thank you, Mary, for joining us. I'm not sure what notifications that guy's talking about. In terms of shadowing, go for it. If you can get someone who's willing to let you shadow at this point, then go for it. Other common things that we kind of see, we get backache, possibly knees as well.
But
Um,
but you would be able to tell me why knees,
mm,
because we were just discussing it. Your feet are not always on the ground; they're always there. And even I've noticed, because I am who I am. When I take my kids to the dentist, I'm like, look at his feet. His feet are always perpendicular to the actual seat. So your feet are never straight. You're always perpendicular. So
mm.
that perpendicular is also going to, again, put the pressure on your knees. So I'm not surprised at all. But it is quite interesting now, because when I do go to the dentist, and when I have the pleasure of just observing the dentist, I'm absorbing quite a lot of things, and especially even when I'm out and about, because
Mm.
all that knowledge then will enable me to correct, and give good advice to people, because you have to have that eye for the knowledge. And also it almost makes you feel more comfortable, because you don't need to explain your work scenario to somebody, because I understand, okay, all right, so your feet are like this, and so
Yeah.
that's why you're going to have the knee pain as well.
So what things could people be doing at home? Is there any points to be using at home for knee pain?
Again, with knee pain is again quite a specialist subject, but it's look after yourself, look after that posture, and as much as you can do, just try and keep them. Try and keep your. Don't try and stress them muscles. Like
Mm.
with exercise, obviously you need to stress, but when you're relaxed, stop putting strain on your body, and be very, very relaxed and not tense. So then
Mm.
the muscles, then slowly, the ones that need to be lengthened can lengthen again, and the ones that can be shortened can shorten again as well.
Yeah, I suppose there's probably a difference between kind of muscular knee pain that we're talking about here, and then maybe arthritic pains in knees and back. If
Yeah, yeah.
someone,
Arthritic knee pain is caused because there's a dryness in the body,
mm,
and also that you've got inflammation and dryness at the same time. So then you then develop arthritis with that. So then again, I will prescribe, I love hल्दी and black pepper tablets for them kind of stuff. But then also I can do some really cool acupuncture in the knees, and there's also some really cool points on the ear for the knee. When I did my ear acupuncture microsystem course, I really was intrigued by it, because obviously you've got we've got our wudu that we have to
cleaning,
clean
yeah.
the ears. So then I was like, you know what, there's something in this. And my mum has had knee problems, and she couldn't do sujood, like she couldn't pray. And so I was like, Mum, let me just do this point. So I did the knee point on my mum, and within 30 seconds of the needle being in, my mum could bend down with no pain. So I was like, wow, so this really works.
That was in the ear again.
Yeah, that was in the ear. I don't know if I can quickly. No, that one. Oh no, it's here.
Caught my
So
phone.
I can show you. Can you see here?
Okay,
So
let's have a look at that.
So you've got all the skeletal system on the ear. So that's all your. Can you almost see that?
Yeah, I think it's a little bit blurry, but yeah, there's
Yeah.
a lot of points there, isn't there? So
Yeah, and then this is all your organ system as well. So your inner ear is organ, and your outer ear there, and then right at the back of your ear is your spine. It is your spine. And I really believe in that because of our wudu. Obviously, Allah knows best, but it's just like, why do we need to clean our ears in wudu? And then when I realized you're tonifying all your body by cleaning out the wudu, because again, reflexology is really famous, and a lot of people acknowledge reflexology, but that same microsystem in the reflexology of the feet, it's the same on the stomach, it's the same on the face, it's the same on the hands, and it's the same on the ears.
Yeah, and do we have a lot of kind of literature backing a lot of this work up as well?
Yes, because again, acupuncture is really is quite well documented with scientific trials and whatever. Obviously, you do you do all the other stuff as well. But with cupping and things like that, there are scientific studies again. But again, in order to hold a scientific study, the actual therapy needs to give lots and lots of money, and sometimes it's not in the best interest for the pharmaceuticals as well. So then sometimes it's quite hard to to get the scientific backing. But again, it's the proof is in the action, really. Again, and plus, what I don't like is I don't like the narrow-mindedness. So when people are narrow-minded in the fact that it can only be a doctor, it can only be a dentist, no holistic thing. No, we need dentists, we need doctors, and we also need holistic therapists. So it's really good, and you need to find what works for you and the cure that's going to help you as well. And don't and you shouldn't really be so negative in all the other stuff that's available as well.
Yeah, I think there's a lot of obviously a lot of these things are kind of within dentistry. We've only just started doing evidence-based dentistry within the last probably 10 or 15 years properly. So there's a lot of areas of medicine which are quite untapped in terms of research. I'm just having a look if we've got anything actually, just because we're getting towards the end. If you're talking about root canal toxicity in that film, then that was pretty heavily debunked actually, if that's what you're talking about there, with that question. I think there are some bits of research out there. I'll probably have a look a bit further into it.
Because I do think in the holistic movement now, people are now getting into grips about the fact that you know, we need to do, you know, evidence-based trials and whatever. So
Yeah,
it's
things.
basically, it's a basic. But in terms of years, now look, Chinese medicines have been
Thousands of years, yeah.
thousands of years. So if it wasn't working, why has it survived?
Yeah, so there is kind of, you need to know exactly what works for what. So I think that's part of the kind of where the research needs to be done, because a lot of it might be quite low quality research at the moment. It's just like, oh, it seemed to help, but they've not done a well-designed study or something like that. So hopefully we'll see some of those more in the near future, and we can really like laser focus onto what's going to work for us and where it's going to help.
Yeah,
Um,
no,
we've
inshallah,
got
that'd be really good, and it's nice because I do feel now that dentists are becoming a little bit more open-minded, and they are looking into, you know, like talking about supplements and holistic kind of things that can help patients, just
mm,
as opposed to just Nurofen and paracetamol for pain kind of thing. So it's, you know, it's really good, and you know, and even with diseases like, you know, gum diseases and whatever, and all the vitamin C stuff. But again, now the evidence is coming through, so that's why a lot of people are now becoming a bit open-minded for it.
yeah, I think that helps with a lot of things. Obviously, acupuncture has been quite heavily researched, I think. So
Mm-hmm.
there's a lot of stuff around that. So once everything gets to that level, then it would be much more easy to even, you know, say actually to patients, it's got a backing in science and stuff like that, because that's what people seem to, it's what people want to hear. You know, that we're not just doing something for, you know, randomly. Um, Trying to think what the other things I was going to ask you were. I think we got through most of it actually. Just going through my notes. Um, yeah, I think that's pretty much everything. I mean, it's a very different topic to some of the other ones that we've had, as you trying to try
Yeah,
push
I
the
know, I
boat
know.
out there a bit.
Yeah, no, and I think it's really important because sometimes I think, again, one of the reasons why I wanted to come on your platform is to show that we're not fuddy duddy. We do understand our science, and we do understand the body, just as you know, because we've had to go through rigorous training in
Mm,
order to get our certification as well. And it's interesting, and it's nice to open the minds of dentists and doctors and all the other people that are going to watch this, just to have a little bit of a think on different things, and also understand that they are therapists that can help them as well.
yeah, I think that's pretty fair. I mean, there's definite uses for, you know, patients who've got um, fear. I think that's pretty obvious there. And then you know, the blood flow with cupping is again pretty well researched as well. You know, because everyone's who's doing professional sport, or some of them are doing that sort of thing as well. So hopefully that'll kind of open people's eyes up to kind of different things that are out there. So yeah, I think that's been really interesting. Any further questions? Someone's asking for a live with advice on how to bring in a practice. Well, yeah, we'll look into that at some point as well. There's a few guys that we've had on that have got practice of their own, so we'll maybe speak to those again. I think we covered all the questions in there now.
Mm-hmm.
Yeah, and we're just up to 5 minutes left. So I think thank you for coming on. I think it's been
No,
really interesting to see something a little bit different compared to, you know, the normal case studies that we do. Something that can help our patients in a different way, and also kind of our own backs and necks and knees and ankles, etc. You know, that we put a lot of stress and strain on.
no,
Um,
that's what it is. And again, with chiropractic and with cupping, it is really important to get to sort out your back, because again, you know, with yourself, if you've got somebody and you're doing normal maintenance on your teeth, and it will prevent a lot of quite invasive procedures. But then if you leave the teeth to decay or to do whatever it needs to do, then it's very hard to get that back to normal. And it's the same with the body. So you should utilize having cupping, regular cupping and regular massages, and have chiropractic when you need it. Just like how you would need your root canals and all your other stuff all the fabulous things that you do with the teeth as well.
Yeah.
Obviously, I'm not a qualified dentist. I don't know. I'm not that good.
Yeah.
I'm just around them, and I sometimes, you
Pick up
kind
some
of
bits
pick
and
up some
pieces.
of the, you pick it up in the staff room.
Yeah. Thanks for coming on. Guys who've been watching, thank you for joining us, and thanks for all the questions that we've had come in. Please make sure you turn on live notifications. We've got quite a few other people coming on. Just this week, we're going back on with Karina from London, who's the specialist endo. We've been doing some case studies with her. We've got on Friday a chiropractor, like we said, so that's Curly Chiro coming on Friday. Saturday and Sunday, I can't remember Saturday. Sunday, we've definitely got Ida Shah from America. She's at Harvard Dental School at the moment. So that's going to be interesting finding out how that is. Make sure you're following Shanila if you're not already. And yeah, thanks for joining us.
All right then, no, Jazakallah
Thank you,
khair.
guys.
All right
All
then,
right, see you later, guys.